Heart to Heart partners with Australian Doctors International to deliver midwifery trainings to community health workers in Papua New Guinea. Papua New Guinea is an island that's about 140 kilometers north of Australia, and they have some of the worst maternal and child mortality rates in the world. Very male-dominated society where a lot of women don't have access to their basic rights, and healthcare is one of them. The majority of women in Papua New Guinea give birth without anyone present. A lot of women are encouraged not to seek care when they're ready to deliver. A lot of women often are told to go off and deliver by themselves without anyone present. It's a 3-week training total. We trained 47 midwives and community health workers. We had a good mix of men and women participating in the training. Our trainers were able to work with the community health workers and midwives and teach them basic neonatal resuscitation so that babies who are born not breathing have a much better chance at survival. The health workers that we train have no basic equipment like stethoscopes, blood pressure cups, fetoscopes, things like that, and so our training is heavily adapted to fit their cultural relevancy and context of where they're working. And by providing them basic skills in both maternal care and labor and delivery, women are now able to have access to health care, which before this, or maybe without it, women would have no one to turn to. When women can't access health care, it diminishes their value in society and kind of takes them a step below the men in their society because they wouldn't necessarily be considered a priority or worthy of receiving health care. So just by providing the skills for the community health workers to be able to provide this care to women, I think in a way kind of speaks volumes and how women should be perceived in the society. We hope to continue to go back and train, but we also hope that the community health workers we train will then go out into their own communities and speak to the men and the women in their communities as well as their colleagues about the importance of ensuring that women are valued enough to be receiving these services just as men would be. My name is Julie Wall and I am a program manager here at Heart to Heart.